and gentlemen. On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to another Diabetes Awareness Series, which is an initiative of the IHW Council and powered by Boehringer Ingelheim. The Think Beyond Sugar campaign has been curated to commemorate World Diabetes Day, which is a global observance that caters to actually creating awareness around diabetes awareness every year on 14th of November. So to continue that tradition at the national level, we are here for our strategic roundtable on diabetes management. The topic for today is diabetes management for a healthier heart. And to discuss about this very significant topic, I am joined by an array of experts. So let me take this opportunity to introduce them. I have with me Dr. Rakesh Sahai, who's the head, Department of Endocrinology, Usmania Medical College and Usmania General Hospital, Hyderabad. Welcome to the discussion, sir. I'm also joined by Dr. Professor Khurshid Iqbal, Chief Consultant Cardiologist at Paras Hospital, Srinagar. Welcome to the discussion, sir. I'm also fortunate enough to be joined by Dr. Manish Ghosh, who's the Director, Endocrinology, Medanta, Lucknow. Welcome to the discussion. I have also with me Dr. Rajeshri Khod, who's the Additional Professor, Department of General Medicine, All India Institute of Medical Sciences, Nagpur.
Hello, good evening.
Good evening. And I have with me Dr. Prem Kumar Panda, who's the Assistant Professor at Kalinga Institute of Medical Sciences, Bhubaneswar. So I am in a way overwhelmed because I am sharing the virtual dais with so many dignitaries. And I hope that this discussion creates a lot of relevant information that our viewers can take along and help them in managing diabetes, especially with the focus on heart health. So coming to you, Dr. Rakesh, I would come to you first. Talking about diabetes management, and since the numbers are increasing in India, if we look at the data, you think there are certain risk factors which we Indians are more prone to when we talk about modifiable risk factors?
Yeah, so I think it is very important to understand the fact that diabetes is increasing worldwide, and in our country it has gone even the increase is happening much faster. And there are certain other things that we need to know, that we tend to develop diabetes at an earlier age, at a lower BMI. I mean, that is even when they are not very obese, we tend to develop diabetes. So these are things that we should know, because that shows that we have a strong hereditary factor, and we need to sort of control the modifiable risk factors, the things that are in our hands. We need to control them effectively to prevent diabetes. And just to apprise everybody of the numbers that we had, of people with diabetes, pre-diabetes and all that, which has come out recently, very recently, from the INDIAB study, which was concluded recently, and in June this year itself it was published, that today we have about 100 million people with diabetes and close to about 130 million people with pre-diabetes. Pre-diabetes is a scenario where they are at high risk of diabetes, but not normal, but not diabetic also, but they are at high risk of diabetes, and these people have very high risk of cardiac disease, as we are today discussing about cardiovascular disease, heart disease. So these are again a large group of people who are at high risk of heart disease, apart from all the other risk factors that are present, that is being overweight, being sedentary, having an unhealthy eating habit. So all these are the risk factors that we should be aware about, and the fact that we tend to develop diabetes at a younger age, even with lesser of these risk factors. So these are some points that I just like to highlight.
Right, Dr. Rakesh, very rightly you have pointed out the risk factors that are there, and when we come to heart health, I would come to you, Dr. Khurshid, for that, because when we talk about diabetes and heart health, so diabetes is a major risk factor when it comes to, our heart health. So when we talk about, key indicators or markers, with that people with diabetes should monitor regularly in order to assess their heart health, what that would be, in your opinion?
Yeah, actually, you're right. Diabetes is considered an, coronary artery disease equivalent. Means even if they don't have obvious coronary artery disease, we take them very seriously. A person with diabetes is already having coronary artery disease or atherosclerotic heart disease or even atherosclerotic peripheral vascular disease. It's a generalized process. So in such people, am I audible? Okay. So in such people, it's very important that they be diagnosed very early. Their diabetes is managed very, nicely. But at the same time, we have to give advice to them so that their risk of developing coronary artery disease or vascular disease anywhere in the body, including, strokes, which are also very common in them, so that the prevalence and incidence of such complications is reduced. So how can we do that? The problem is that worldwide, diabetes awareness is very much there. But when it comes to the treatment, there are hardly any, not more than 30 or 40% who are actually, properly managed or properly taking treatment. A lot of them will start it and give it away. And the same is true about here also. And, in rural settings, it is even worse. So we have to diagnose them early, give them prophylactic treatment, and at the same time, give them advice about their diet and management of other comorbid risk factors. Diabetes is the number one risk factor, but a lot of them will have hypertension. They might be smoking, they might be obese, and these things compound together. And the result is that their coronary artery disease incidence becomes higher and higher. Diabetes in itself doubles the risk of vascular disease. And on top of that, if they have uncontrolled hypertension, uncontrolled obesity, and of course, if they are smoking and they are dyslipidemia, of course, is also very common in Indian scenario. And the study Dr. Sahai was referring to, dyslipidemia was prevalent even in rural settings. There was hardly any difference between rural and urban. Although in diabetes, there was a difference, but in dyslipidemia, there was no difference. In hypertension, there was no difference. And in fact, in such people, we have to be very, very energetic in telling them. So it's not that simple a matter to manage such a thing. So it has to be at multiple levels. I think when we go about this discussion, we'll probably go for those things also. That's how I will put it.
And all, yeah, Dr. Khurshid, thanks for talking about the, important modifiable risk factors. Dr. Manish, coming to you, when we talk about personalized care in diabetes, and managing the overall quality of life of patients, and their unique health profiles, what are the important benchmarks, when we think of with a focus on heart health? What are your considerations while drafting that plan of action for that?
मैम, हम किसी भी तरीके से डायबिटीज या हार्ट डिसीज की बात करें तो हम वी आर इन यूपी लखनऊ। तो हर किसी पेशेंट को ना हम दो ही चीज बोलते हैं, एक तो हाथ पैर चलाना है और मुंह पे कंट्रोल करना है, कि अच्छे ढंग से फिजिकल एक्टिविटीज करना है और डाइट आपको बहुत अच्छे तरीके से रेगुलेट करना है। मोस्ट इंपॉर्टेंट पैरामीटर यही होता है कि मैम पेशेंट फॉलोअप में आएगा कि नहीं आएगा। मोस्ट ऑफ द पेशेंट फॉलोअप में कई बार मिस कर जाते हैं, दवाइयां छोड़ देते हैं। सबसे दूसरा कल्प्रिट फैक्टर हम लोग को मिलता है। तीसरा कि वो रेगुलरली हम लोग के साथ टच नहीं रहते, तो उनके फॉलोअप पीरियड में हम लोग को पता नहीं रहता कि ग्लाइसेमिक कंट्रोल कैसा चल रहा है, ब्लड प्रेशर कैसा चल रहा है, लिपिड कंट्रोल चल रहा है कि नहीं चल रहा है। तो हम लोगों को सबसे ज़्यादा फोकस इसी चीज़ पे करना है कि कैसे पेशेंट को और मोटिवेट किया जाए और काउंसलिंग की जाए कि कम टू द क्लिनिक, कम टू द क्लिनिक। यहाँ नहीं आ सकते, नियर बाई डिस्ट्रिक्ट हॉस्पिटल है, नियर बाई हेल्थ केयर सेंटर है, कहीं पर भी रेगुलर फॉलोअप में एटलीस्ट सेटिंग पे रहें आप।
Very right, Dr. Manish, very rightly you have pointed out. Coming to you, Rajeshri, ma'am.
Yes.
Since you come from that, primary healthcare setting background. So when we talk about, because Dr. Manish talked about adherence, then of course there's this myth related that, insulin khate hain, to phir you have to continue, or, for your lifetime. And there are a lot of misconceptions related with medical interventions for diabetes, especially. So how do you manage that? And do you think counseling the patient, making him aware of the risk factors, the impact on his overall well-being, how does that work?
Yeah, it's very important that the patient should be aware of his illness and he should have an insight into his illness. And nowadays, we are talking of precision medicine and personalized diabetes care. So just like one size does not fit all, so every patient is different. So it is very important that we diagnose the disease correctly. Along with that, we should also screen the patient for any target organ damage. We should all the baseline parameters of the patient, whether patient has got hypertension, whether patient has got dyslipidemia, whether patient has got obesity. So these things are very, very important because these are definitely going to require drug treatment. And then we have to tell the patient what are the modalities which are available for treatment. And lifestyle intervention, as you know, in most of the clinical trials, that has been found to be a very significant modifiable risk factor, which has a benefit on mortality because of cardiovascular events. We have drugs which are very, very effective. And nowadays, we are having the drugs which have come up, which have a cardiovascular benefit. So that is important to counsel the patient. Ours is definitely a tertiary care center. So we have patients who are referred to us basically. And here comes the role of diabetes educator. So most of the tertiary care centers will have a diabetes educator. So because the doctors are very busy, they may not be able to counsel the patient, but a diabetes educator does the job very nicely. So the educator will explain the patient about insulin treatment, about the oral anti-diabetic drugs, about the side effects of the drugs, what they can expect. Many times now we have those GLP-1 analogs as well as the SGLT2 inhibitors. They all result in drastic reduction in weight. So many times relatives come and say the patient is not improving because he is losing so much of weight so fast. So we have to explain everything to the patient. And this is very, very important. And now what we follow is that if patient comes with severe hyperglycemia, especially with a fasting blood glucose of more than 250 milligrams per deciliter, we give the patient insulin therapy for a short duration. Later on, we can switch the patient on oral anti-diabetic drugs because by the time the patient is diagnosed, 50% of his beta cells are already non-functional. So that is the reason this early insulin therapy, it goes a long way in prevention. So that we have to explain the patient. We tell the patient that you take insulin for 15 days, 1 month, and we will definitely stop. And it happens. You just start insulin in low doses and we have a very rapid control of diabetes. So these are the recommendations which we are trying to bring into practice. And of course, education, repeated contact, repeated follow-up, that helps in adherence of the patient. We also have a lifestyle intervention clinic in our institute where we give a very proper lifestyle advice to the patient. And the patient is told everything from exercise to diet and everything. And one misconception is patients feel that if they are diabetic, they have to stop eating. It is not like that. They don't have to starve. They have to eat a healthy diet. So for that, we, according to their taste and culture, a diet is devised for them. So all this goes together to take control of the cardiovascular risk in diabetic patients.
Right, Dr. Rajeshri. That was a very insightful overview that you have given. Coming to you, Dr. Prem, if we talk about lifestyle intervention, since all the doctors have spoken about how that modifiable risk factors and managing your lifestyle is an important part. So what advice would you, if you have to give 5 tips to a normal person how to manage your diabetes, what would be your 5 tips for that? You are on mute, sir. You are on mute.
Good evening, everyone. So this is a very nice topic as we are discussing about think beyond sugar. Okay, whenever a patient comes to, we are not only treating how to reduce the blood glucose level, or we are not treating how to reduce the HbA1c level. So it is overall decreasing the macro and microvascular complications. Hello, hello, is it audible? Hello.
Yeah, we can hear you.
Yeah,
Yes,
yeah.
you are
So
audible.
it is
Yes.
it is always a goal oriented approach. So managing diabetes is always remains is it only the sugar reducing approach. So for if you say the 5 approaches how you will control sugar or how you will control the blood glucose level in diabetes. So I will say the first thing is refrain from alcohol and tobacco. Certain people from maybe some from internet and some other articles they read and tell, sir, if I take some alcohol, is it good for me or is it bad for me? Okay, so we can see some articles which tell that moderate amount of alcohol consumption is good for. There is no definition as such for Indians. What is the moderate amount? Okay, so always so we suggest to the diabetes educators. We tell the patients to refrain from alcohol and tobacco. Be it be smokeless or smoke tobacco. The second is about the diet. Whenever a patient falls ill, be it some chronic disease or some communicable disease, they ask, sir, what to eat and what not to eat. That is very important. At times, what happens, sir, मेरा diabetes हो गया, मैं शक्कर खाना बंद कर दूं, मैं मिठाई खाना बंद कर दूं. They ask various questions. Sir, मेरा diabetes हो गया, मैं मटन खाना छोड़ दूं? Yes, but we think that we don't. What happens if we say that you should not eat, you should not do these things? What happens? It actually affects the mental status of the patients. Okay, so whether we should counsel them such that they will restrict the intake of high energy foods. It is not that if diabetic patient cannot eat sugar. If someone is taking high energy food also, it is risk factor for diabetes. So they should take the foods which are uh, energy deficient, or we can say less in energy content. Okay, and also as diabetes is the sister, or we can say the brother of various cardiovascular diseases or hypertension. As per the WHO, it tells the ideal salt content in a day should be less than 5 grams per day or 3.5 milli equivalents of sodium per day. So, accordingly, we have to restrict the salt intake. Accordingly, we have to restrict the salt intake. Okay. Next comes about the diet. If we talk what oil to take and what oil not to take. Okay. So it is always better to take MUFA oils containing MUFA and PUFA, monounsaturated fatty acids and polyunsaturated fatty acids. So accordingly, we should tell them what are the sources of MUFA and PUFA, so that the patients or the subjects who are coming to our clinic, they can just orient themselves what to eat and what not to eat.
What
Okay.
not to,
So
right?
this is
Right.
all about diet. And
Diet.
next is about next is सर जैसे बोल रहे थे कि हाथ पैर भी हिलाना है, ठीक है? So it is
Physical
about
activity
physical activity.
is
Okay.
important,
So
right?
yeah. So WHO tells you should do at least 150 minutes of moderate intensity exercise.
Exercise.
So moderate
That is
intensity
very
exercise, if we are talking, then moderate intensity means you have to do the brisk walking, okay, or another some recreational like swimming or playing badminton or dancing, okay, or doing the household work. So these are all moderate, means it
physical
increases
exercise.
our heartbeat or heart rate. Okay.
Right.
So both aerobic and resistance training should be done by the diabetic patients.
Right.
Okay. So because in certain studies it has been seen meeting the physical activity guideline, it decreases around 40% of cardiovascular mortality.
Right.
So physical activity.
Activities.
One more thing.
I'll come back to you on the risk factors. Dr. Rakesh, coming to you, when we talk about, awareness, there is a lack of awareness because, early detection is important to proactively manage diabetes. And when we talk about patients, many, if you go in rural areas, there are many researches which indicate that people are not even aware of, of the fact that they have diabetes. So you think, what are some of the ways through which that kind of awareness can be, given to patients to make them realize that yes, they should go for screenings and early diagnosis that can play a key role in managing your diabetes effectively?
Yeah, so I think very rightly you put it that if you look at I was just alluding to the ICMR INDIAB data, and I was saying that there are about 101 million people with diabetes today, but the sad part is that half of them don't know that they have diabetes. And when they don't know that they have diabetes, what happens is that they end up with complications. They come to know about diabetes only when they start developing complications. When they go to Dr. Khurshid Iqbal with a heart attack, then they know that they have diabetes. Or if they go to a kidney, they develop kidney failure, or they develop peripheral neuropathy, or develop the ulcer, then they come to know that they have diabetes. So it is the sad part is that it is diagnosed late. So it's very important that we should increase the awareness. We were all speaking about, about what we will tell our patients, and how we will counsel them, and how are we going to increase their adherence. But now we are speaking about, making the general population aware that there is a risk of diabetes after the age of 30, 35. You should be screening yourself for diabetes, checking your blood sugar. It's a very simple test, and you should go for that test, so that, particularly if you have got a family history of diabetes, if you've got you're overweight, if you're having and for women who have had had diabetes during pregnancy, or if they have had a PCOS. So this sort of awareness should be increased at the population level. We should try to make people aware throughout the country, and not just the people who are coming to our clinics, because the people who are coming to our clinics are just the tip of the iceberg. There are a large number of people who are not coming to us, and we need to devise ways of increasing this awareness. And probably this is something which we should all pay attention to, and we should all try to see how we can spread this message across.
Exactly, yes, that awareness is important, and that's why we have sessions and roundtables like this. Dr. Khurshid, coming to you, when we talk about heart health, and its connection with diabetes, what is your take? Like, medical intervention is important, and treatment modalities, like you touched upon them briefly. But if we talk about newer and innovative techniques when it comes to cardiovascular health, which can have a positive impact on diabetes management as well. Please share some insights on them.
Yeah, some of it has been, addressed by Dr. Sahai. First is the prevention, the preventive measures. Preventive measures doesn't mean that, you can totally, prevent diabetes. We are genetically susceptible. And there are people who have insulin resistance. There are people who have insulin deficiency starting at a very early age. But coming to specifics, how to improve heart health. Now, if somebody is diabetic, so as I already alluded to, he is already twice susceptible to have cardiovascular disease. So number one, and first and foremost, is a very good management of diabetes. And luckily, the drugs that have been shown to improve diabetes management are also have been shown to improve heart health. As one of the participants did allude to, two important drugs, SGLT2 inhibitors, very very freely available and not very expensive. That probably should form one of the primary agents, as a starting agent, because it has been seen to improve heart health, kidney health, as well as control diabetes and hypertension. And then the GLP-1 analogs, they are actually very expensive at the moment, but oral agents are now available, and they can reduce a person's weight. Somebody is very obese. So there are some agents that have been, anti-diabetic agents that improve heart health. But apart from that, dyslipidemia is very common. So you have to give statins to these patients. In fact, if somebody is not dyslipidemic, even then, a statin is an essential constituent of the treatment in a diabetic patient. Of course, you have to see that hypertension is under good control. Your diet is, your lifestyle is, your activities as mentioned by one of the participants, how much he should exercise, how much should he dynamic exercise he should do, and what kind of food he should take. That also falls part of the preventive and a proper strategy for a patient to prevent cardiovascular disease, and also if somebody already has a cardiovascular disease, to make him less prone to a complication. In addition, as I already said, smoking is absolutely very, very bad, not only for heart health, for as a general, thing that leads to so many, problems. So smoking has to be stopped if somebody is smoking. Alcohol in moderation does, show some benefit, but because of its other harmful effects, they outweigh the benefits. So alcohol is, somebody who's diabetic, he absolutely should not consume alcohol at all. These are important things, but now if somebody has a coronary artery disease or a cardiovascular disease or a, cerebrovascular disease, then he is also prescribed an blood thinner, an antiplatelet agent, which is an important, constituent of the treatment of diabetic patients. Whether he is diabetic or not, that is part of the treatment. So I would say that, as Dr. Sahai said, it's what we see in our clinics and in our hospitals, tip of the iceberg. And we may have good patients who have a regular follow-up, but as we have already discussed, a lot of people don't know that they are diabetics. A lot of diabetics don't take proper medication, and they may not have access to proper medications. So we have to do much more hard work and find modalities by which the general public becomes aware. And it is said that if somebody is beyond, after the age of 20, 25, we should do, general, serum chemistry, maybe once in 2 years or once in 3 years. That's how we'll know. Like HbA1c, this hardly HbA1c is hardly done in a private, government hospital. And in specialized clinics, also only 30% of the patients are given this. And this is a very good tool to diagnose diabetes, establish diabetes. So there are many things that need to be done at the societal level and at the hospital level.
Right, Dr. Khurshid. So Dr. Prem Panda have to leave us. He has some urgent work. So I'll just ask a quick question to Dr. Prem. If we talk about common misconceptions and myths associated with diabetes management, because I've seen a lot of people saying, "Arey, मैं तो मीठा नहीं खाता, मुझे diabetes नहीं हो सकता." That is a blockade that we Indians have. So how do you cope with such kinds of misconceptions when you're in your clinical
Yes.
when patients come to you with that?
Yes, ma'am. Actually, there are we can say there are myths about diabetes. People are ignorant about the things what are happening in diabetes. First thing is loss to follow. Whenever they think that this is just like malaria or any other fever, so if we prescribe some medicine for 2 months, okay, they will just take those medicines for 2 months, and after that they will think that is I have taken medication, so my diabetes is subsided, and so I need not visit the physician again. Okay. And what happens sometimes patients say, sir, my fasting blood sugar was initially 185 and PPVS was some 300 and now it has come down to 125 and 165. So do I need to take medications? At that time, we need to make them understand that because you are taking medications, that way it is under control. Once you stop taking medications, it will just shoot up like anything or whatever the previous level it was. So next thing is the thing is that loss to follow. So and the second thing is that after 2 months, if we say that whenever you are coming after 2 months, come with these reports like fasting, PPPS, and all this RFT, LFT, all these tests. Okay. So the patient, what the patient does, he stops the medications after 2 months. Then he comes with FBS and PPS report again, that is 185 and some 300. Okay. So it becomes difficult. So we have to counsel them accordingly that whenever you are taking medications, at that time only you have to take you have to do the FBS and PPBS. Okay, this is one thing. Okay, and the second thing is that they ask, sir, can we take fruit during, or if we are having diabetes, can we take fruit? Yes, definitely you can take. You can take the foods which are having moderate and low glycemic index. Okay, so those, the glycemic index, were the glycemic index value is less than 55. You can take those foods easily. There is no issues if you are taking. Also, you have to tell, you have to focus on the things about the glycemic load. Means it depends totally about on the person. At times, patient asks, "Sir, can I take some sweet?" At times, yes, definitely, no issues. But it depends upon the portion you are taking. Okay. So the needs is that next is at times we think if you take more sugar, then the chances of diabetes is more. Okay, it may be,
Right,
but sugar is not the only cause of diabetes. I was telling, the high energy or energy dense foods are always the cause of diabetes.
right.
So we should counsel
Thank
them
you.
accordingly.
Thanks, Dr. Prem, for being a part of the session. Coming to you, Dr. Manish, are you there? Yeah, Dr. Rajshri is there. I think Dr. Manish. Okay, so if I come to you, Dr. Rajshri, and we talk about how, how important is stress as an, factor, as an important factor that needs to be, because stress can, plays a major role in diabetes as well as cardiovascular, health. So how important a factor is stress, and how can, this shift in urban lifestyle with so much of happening around you, how can you manage your stress levels in a proactive manner?
Stress definitely has to be managed in a proactive manner, because if your mind is happy, your heart will also be happy. So that is the thing which we have to tell the patients. And once you diagnose the patient that he has got diabetes, naturally his adrenaline levels increase, because in front of his eyes it comes that he has to do diet, he has to do exercise, he has to modify his lifestyle, he has to decrease his weight, he has to maintain his sugar levels. If there is additional blood pressure, that has to be controlled. So this is definitely an additive factor. Now, if you go by ADA recommendations, the only primary preventive measures which are helpful in reducing the cardiovascular mortality is basically lifestyle intervention, one. Second is a blood pressure control. This is more important than glycemic targets, because we have seen in many studies like ACCORD study where hypoglycemia resulted in more mortality, and those studies had to be abandoned. And another is lipid management. That is why in diabetic patients, right from the beginning, depending on their cardiovascular risk, their age and how much is their cardiovascular risk, we have to decide whether they should be given a low intense statin therapy, a moderate intensity statin therapy, or a high intensity statin therapy. So these three have got very important primary prevention benefits. So they have to be stressed on the patient. As far as stress is concerned, stress definitely contributes to the worsening of glycemic control, because it is going to affect the behaviors of the patient. So stress management is really very important. And for that, we do have many measures that are recommended, like they can do meditation for some time daily, or they can have a better time management. In nowadays in urban places where we have more of working women, we have people who have to commute a lot for work. So stress management is definitely a personalized issue, and that goes a long way in controlling the diabetes also, and in preventing the other complications. But it's an additional factor which has to be looked into, that I would say. And we shouldn't deviate from our primary targets of managing diabetes, which is a good lifestyle control, a good lipid control, a blood pressure control, and within normal glycemic targets.
Right, Dr. Rajeshri. Dr. Rakesh, if I come to you and we talk about how, stress management and that shift towards an urban lifestyle is one of the most important factor. So going back to basics, if we talk about traditional way of living, especially when it comes to food, and of course, those managing your sleep time, and of course, things like that. You think they can make a key impact when it comes to managing diabetes? Are on mute, sir.
Yeah, sorry, I was on mute. Yeah, so I think you have brought out very important factors while we were discussing about, very new innovations and all that. But it is also important to not to forget our, simple things like a good lifestyle, as we have been discussing, and the most important part is the sleep, because now what we are seeing is that a lot of people are working in the night, sleeping during the day, and that actually alters their circadian rhythm and causes a lot of issue, lot of problems, particularly increasing the risk for development of obesity, diabetes, heart disease. All these problems increase when there's a disturbance of sleep. So I think that is another important factor which has to be addressed everywhere, and people have to be given I mean, have to understand the importance of a good sleep cycle. I mean, when you're disturbing the sleep cycle, then you're going to encounter many of these problems. And as you said, managing stress is very important today, as all of us are saying that we are into so many things happening all around us, that we need to know how to adapt to the stress. You cannot say that somebody is without stress. Every person is stressed, but how we adapt to that stress is very important, and that decides whether we end up with diabetes and cardiovascular disease, or are able to go through without these things. So I think these are some important points, and I think our tradition, I mean, our traditional lifestyle has been good towards preventing these problems, and several and exercise, I think, is very important. So spending at least half an hour every day with on good physical activity, where your mind is also diverted from your stress and all that, from your routine, makes it very important for people to overcome the stress and manage diabetes, prevent diabetes also.
Right. Thank you, Dr. Rakesh. Dr. Manish, coming to you, when we talk about that collaboration, because at the end of the day, better health outcome for the patient has to be the goal. So when we talk about those collaborations between, counselors, then of course we have endocrinologists, cardiologists, with, in management of individuals with diabetes. तो आप कैसे किस तरह से देखते हैं उस पूरी पिक्चर को? हाउ कैन वी इंश्योर देयर आर बेटर कोलैबोरेशंस बिटवीन डिफरेंट स्टेक होल्डर्स, फॉर जनरल पब्लिक टू अंडरस्टैंड द वेरियस एस्पेक्ट्स ऑफ द डिजीज?
You're muted.
On mute, sir.
मैम, एवरीवन इज इम्पोर्टेंट. अगर हम बात करें पेशेंट जो है, पेशेंट के साथ जो उसकी फैमिली है, फैमिली का इम्पोर्टेंस सबसे ज्यादा है. इमोशनल और साइकोलॉजिकल सपोर्ट सबसे ज्यादा उसको वहीं से मिलने वाला है. जितना ज्यादा वहां से सपोर्ट आएगा उतना ही वो मोटिवेटेड रहेगा. उसके बाद रोल आता है एक जनरल फिजिशियन का, जो उसको प्राइमरी केयर करता है. जनरल फिजिशियन के हिसाब से अगर लगता है कि उसको अभी दिक्कत है पेशेंट को, कि वी हैव टू कंसल्ट विद नेफ्रोलॉजिस्ट, कार्डियोलॉजिस्ट, न्यूरोलॉजिस्ट, क्योंकि जैसे ही ओल्ड एज होता है चांसेस ऑफ डिमेंशिया, चांसेस ऑफ इजी फॉल के बहुत ज़्यादा इंक्रीज हो जाते हैं. डायबिटीज़ को अगर हम देखेंगे तो चांसेस ऑफ न्यूरोपैथी बहुत ज़्यादा कॉम्प्लिकेशन है. एक नेफ्रोलॉजिस्ट का काम भी काफ़ी इंपॉर्टेंट हो जाता है इन केस ऑफ जैसे ही थोड़ा सा सीकेडी प्रोग्रेशन पे शुरू होता है मैम. तो एवरीवन इज इम्पोर्टेंट, इंक्लूडिंग ऑप्थेल्मोलॉजिस्ट इज वेरी इंपॉर्टेंट इन टेक केयर ऑफ डायबिटिक पेशेंट. साथ में जो डायबिटिक एजुकेटर है हमारे पास, वो तो बैकबोन है मैम. अगर उनके बिना तो काम ही नहीं चलता है. पेशेंट का इज जो काउंसलिंग है कि उसको सेल्फ मॉनिटरिंग ऑफ ब्लड ग्लूकोज करना है, रूटीनली करना है, उसको हर 3 महीने में एक बार फॉलोअप में आना है. फॉलोअप में कौन कौन से टेस्ट एडवाइस किए गए हैं. पेशेंट नॉन अल्कोहलिक फैटी लीवर की डिसीज का तो नहीं है, उसका फाइब्रोस्कैन हुआ है कि नहीं हुआ है, फाइब्रोस्कैन की ग्रेडिंग क्या है उसकी. ये सब एक इनडायरेक्ट एविडेंस है कि उसको कार्डियोवास्कुलर मोर्टेलिटी का रिस्क कितना रहेगा. सेंट्रल ओबेसिटी इज अनदर कल्प्रिट फैक्टर. ऐसा है मैम, जिसको जितना ज्यादा कम कर सके उतना ही अच्छा है. सेंट्रल ओबेसिटी कम करने के लिए सबसे इंपॉर्टेंट पैरामीटर इज वॉक, वॉक एंड वॉक. वॉक नहीं कर पा रहे, डांस कर लो. डांस नहीं कर पा रहे, साइकिल चला लो. साइकिल नहीं चला पा रहे तो कुछ भी डांडिया कर लो, मगर कर लो. इसके बाद में आता है उसका खाने पीने का पैटर्न. खाने पीने के पैटर्न में मैम हमेशा गड़बड़ होता है. सबसे सिंपल पैटर्न है, करना है क्या है, ककड़ी, खीरा, मूली, गाजर, टमाटर, प्याज खाना है. कैसे खाना है? जितना खाना खाते हो उसमें से एक रोटी कम कर दो, रोटी की जगह सिर्फ सलाद खाओ. आपको चावल खाना बड़ा पसंद है, कोई बात नहीं, आप चावल खाइए, रोटी बंद कर दीजिए, एक समय पे एक स्टेबल डाइट ले लीजिए, आधा रोटी और अच्छा। जब भी कुछ खाइए, उसको जितना खाया है, एक्स्ट्रा कैलोरी खाया है, पचाने के लिए, टहलने के लिए चले जाइए, बस जितना एक्स्ट्रा खाया है। तो हम लोग को पेशेंट की बुराई नहीं करना है, हमेशा उसको ना मोटिवेट करना है, नहीं तुम कर सकते हो, तुम कर सकते हो, वेट लॉस कर सकते हो। डॉक्टर साहब, मैं 6 महीने से टहल रहा हूँ, मैं वेट लॉस नहीं कर पाया। कर सकते हो, और करो, और डाइट पे कंट्रोल करो। वो करेगा, वो आलू का पराठा बंद करेगा। अगर हम नहीं बताएंगे तो मैम वो नहीं करेगा फिर कभी। तो एवरी टाइम इज मोटिवेशन इज वेरी इंपॉर्टेंट।
That is a very practical tip that you have given our audience, motivating them for that lifestyle. Dr. Khurshid, coming back to you, when we talk about heart health, we have recently seen many younger people getting affected, getting heart attacks, and of course, so this is this mantra of catching them young. So do you think that level of awareness creation needs to be there, especially amongst the kids, because that shift in lifestyle, having junk food and uh, screen pe baithe hain, they are not going for walks? You think there is a correlation there, and how can we effectively manage that gap?
Absolutely, yes. We are not only seeing young males, we are seeing young females now. If you see in many states, people in 20s and 30s are getting myocardial infarction very commonly. And you must have heard so many times that sudden deaths happening. And the number one cause of sudden death is coronary artery disease. So as I earlier said, you need to get yourself assessed. Even if you are healthy, you cross your 20th birthday, you must get your baselines assessed, and then do them every 2 or 3 years. Then comes the junk food and not only junk food, very odd food here and there, and not timely food, no exercise. And our younger generation is now, work from home has, created another syndrome. They are not, they used to at least move around. Even if they would go in a car, they would go walk up to the car or up to the bike. They don't even do that. So that has added to that. People have become the younger generation has become totally sedentary. And this work from home is not that easy. It's actually more tiresome, more, troublesome for the person. And he has to be, kind of in one particular area all the time, unless his, department is allowing him some respite in between. So things have become very difficult. And after this COVID-19 surge, people still are not going. There are many organizations, they are not still going back to the previous, particularly the multinational ones. They are still continuing with this because their productivity has increased because of this. They are extracting too much of work from the. So, in a nutshell, I would say that it comes down back to the same, that you need to have good lifestyle, means you must be active, your food must be balanced, that has been already discussed, and of course you have to take the preventive as well as curative medications. So that I would like to say in this regard.
Thank you, Dr. Khurshid. I'll come back to you for one final question after taking some perspectives from our co-panelists. Dr. Rakesh, coming back to you. In your practice, because Dr. Khurshid also talked about how, there is a need to create awareness. And when we talk about common misconceptions, Dr. Prem Panda briefly touched upon it, but I wanted your perspectives on that because, we have in the Indian context, we are people who are prone to that sweet things in life, koi bhi festival ho, kuch ho, there is this urge to have some meetha. So, and I have seen people saying that, main to meetha nahi khata, mujhe kyun ho gaya? So what are some of the common myths or misconceptions that you have seen in your practice when it comes to diabetes, and how do you counsel the patient, or how can we bridge that gap, when it comes to false information?
Yeah, so I think one of a couple of things that I would like to highlight. I mean, although there are a lot of things about food, I mean, people knowing about what is good food, what is right for them, the healthy food, what is healthy food. These are many things that we need to educate people about. But apart from that, a lot of other misconceptions that happen, as Dr. Prem Panda was speaking about, when to do a test and how to do the test. That also is a problem many times. So ultimately, what happens is that they don't get proper advice from the doctor, because they go every time they go with a not doing the test properly, not understanding exactly what has to be done, not being compliant with the medication. So those are issues again. Then the third thing is that happens is that many times when people need medications to be taken, they are hesitant to take medications, because they feel that today, now the new concept that has, many people are advertising about remission of diabetes. So many people think that they shouldn't be taking medicines, and they should be trying out for getting into a reversal or remission of diabetes, which does not happen without medications. That can happen in some situations. They may be in a position to do that, but not everybody. Somebody who comes with a very high glucose values is not a person who's going to be able to go into remission with just he may be obese, he may be having diabetes for a very short duration, but if his blood sugars are 300 and 500, he's not the person who can go into remission with just changes in his lifestyle. He needs to take medications, take insulin, as Dr. Rajshri has just highlighted that, and then think of remission later on. Once he's metabolically healthy, then he thinks about working hard towards losing weight and going into remission. So such misconceptions are there. There are a lot of misinformation that is spread around that. That is something which we need to see, that patients are not are given the right information, and they are able to follow the simple measures, as Dr. Manish has very simple terms. He's been telling us very simple things, which are very easy to follow. It's only that they shouldn't be getting into the wrong advice and getting into misconceptions. So Dr. Prem is also back. He may add to the misconception.
Welcome back to the discussion, sir. Coming to Dr. Rajshri, when we talk about awareness creation at a mass level, and there is this nowadays people, before going to a doctor, they Google their symptoms actually.
Yeah.
So there's a lot of information coming, but where is that safety net, and how do we ensure that because self-medication, diagnosis is also a very very negative aspect of so much of information, though there are sessions like this where we actually create awareness and empower individuals with the right kind of knowledge. But what about the other information that is proliferating?
We of course we do not discourage patients from Googling. We tell them yes, they can Google, they can find out, they can read about side effects, but they are all theoretical. Practical things are much different. And I would like to add to whatever we are discussing is, we did one project where from our diabetes clinic, we took out patients who were not well controlled, a set of patients, and to them, we trained them to do a diabetes self-management. So it is a protocolized thing nowadays, which is called as diabetes self-management education. So before enrolling them into the program, we gave them this we gave them this training in the form of 2 or 3 individual sessions and 4 or 5 group therapy sessions. So as a group, we address them. As a group, we train them how to take care of their food, what diet they should follow, how much they should exercise, and how they should take their medications, how they should test themselves. So we had a questionnaire, so which they did it before enrolling into the program and after. And we found a very significant statistical difference in diabetes self-management before enrolling into the program and after the program. So it definitely helped to create awareness in a larger set of patients rather than giving them individual counseling. So diabetes self-management education is very, very important, and that will definitely go a long way in training the masses to take care of their own diabetes and clearing the misconception. Because in group session, there are so many questions that come to you, there are so many misconceptions that come to you. So that is a very good way of tackling the diabetes or increasing diabetes awareness at a larger level. But only thing is, you can do it in community also. We have our urban and rural health centers. So there also we are taking this program. We have a community project also where we are trying to check for the cardiovascular burden and also try to implement the preventive measures.
Right, Dr. Rajshri,
Yeah.
very rightly pointed out that self-management is important. Dr. Gurjeet, coming to you, when we talk about self-management, and when it comes to managing your vitals, and now with the click of a watch, you can, with smartphones and things like these, it has become easier to keep a, check on these things. So do you think that the coming years will have a positive impact in that sense, since individuals can now just with their smartwatch keep a check on their lifestyle, how many steps they have taken, what is the blood sugar level? So are things going to improve in that sense?
Yeah, actually, there are so many gadgets that are coming up. Not only checking your heart rate, they can check your blood pressure, they check your saturation. And some of the, some of the phones are having even an ECG monitor inside. So, but that cannot be a thing which can be given to, it cannot get generalized, and it is cost intensive. Of course, with passage of time, the cost might come down, and there might be a lot of people who might consider using such gadgets, helping them manage their diabetes, hypertension, and so on. But I would like to say, commend Dr. Rajeshri for taking up a wonderful program which can be expanded to the community. When there is a group, the people will interact with one another, and that definitely can help them understand the different causes of diabetes and its management. So that is something which can be done at the community level, at a larger level. Now, coming back to your, managing and regulating your diabetes with newer modalities, newer techniques, is that there are a lot of diabetics who don't, in general, the management of diabetes all over the world, as I said, only 1/3 are, taking their medications optimally. So things are not that bright even in West or in Europe. But, third world countries and low and middle socio-economic countries have the highest burden of diabetes. So it's the shared number which we are facing. So something needs to be done at the community level to create the awareness and at least get them a drug treatment which has been found to be, useful in terms of cardiovascular safety also. So as I said, even insulin, wherever it is needed, a lot of patients hesitate, and a lot of hospitals don't have them. They are not in stock. So management of diabetes, it's not only the problem with burden for the patient, it's burden for the hospital also. So a lot of work is done on national level. There are a lot of programs there, but there is a long way to go, because the shared number of diabetics in South Asia is, India is probably going to outnumber China in either one or two decades. It was probably number 8th or number 9th just 3 or 4 decades back. Now it has come to number 2. China is the only other country that has more diabetics than India. And adding the pre-diabetics, which are nearly 15% in rural areas. So probably 1/3 of Indian population has some sort of dysglycemia. So these gadgets and these newer, digital technologies may benefit some of the people who are very tech savvy, and but in general, I don't think it's going to make any difference.
Yeah, because the issue of accessibility and affordability is there. So I think we are already running short on time. So I'll just come to all the experts for their one final key takeaway. So Dr. Manish, coming to you, how would you summarize anything that you feel is important and we have not discussed till now? Anything that you would want to, just tell our audience about diabetes management and a healthier heart?
मैं थोड़ा सा इसमें ना ये बोलने की कोशिश करूंगा कि जैसे पहले पेशेंट हमारे पास पहली बार आया, फर्स्ट टाइम डायग्नोसिस है, तो अब जैसे शुगर का टैबलेट स्टार्ट किया, डायबिटीज का टैबलेट स्टार्ट किया, तो उसका पहला क्वेश्चन होता है, डॉक्टर साहब कब तक चलेगी? तो पेशेंट के बारे में यही सबसे इंपॉर्टेंट होता है कि उसको एक ही चीज बताना है, शुगर को कंट्रोल कर सकते हैं, खत्म नहीं कर सकते।
Exactly.
रेमिशन होता है, बहुत कम लोगों में होता है, वो भी सिर्फ 2 ही थेरेपी पे अप्रूवल है, तो परसेंटेज ऑफ चांसेस इज वेरी लेस। अगर न्यूली डायग्नोस्ड है या बहुत समय से शुगर का बीमारी है, आपने इंसुलिन इनिशिएशन का प्लान करके रखा है कि नहीं इसका शुगर ऐसे लिमिट का है, किडनी में डिसीज है, लीवर में डिसीज है, कार्डियोवास्कुलर डिसीज है, इंसुलिन स्टार्ट करना, आपने इंसुलिन जैसे लेगा, पेशेंट बोलेगा डॉक्टर साहब इससे कोई घाटा तो नहीं होगा? उसका सिर्फ एक ही जवाब है, नहीं, इंसुलिन लगाने का बहुत गंभीर घाटा है। पेशेंट पूछेगा क्या घाटा है? एक ही घाटा है, उम्र बढ़ जाती है, होने वाला नुकसान खत्म हो
कम
जाता
हो
है।
जाए, राइट।
तो पेशेंट को उसी की लैंग्वेज में उसको समझा देना है। अगर पेशेंट, जैसे आपने प्रिस्क्रिप्शन लिखा, इट इज ओनली फॉर 15 डेज, कि आप 15 दिन बाद आके रिव्यू करिएगा। पेशेंट आता है 6 महीने बाद, डॉक्टर साहब आपने दवाई तो 15 दिन के लिए लिखी थी। दवाई 15 दिन के लिए नहीं लिखी थी, आपको 15 दिन में बुलाया गया था। तो ये छोटी छोटी चीजें क्लियर करना इज वेरी इंपॉर्टेंट।
Right, and even caregiver counseling, जैसे आपने बात की, that is also important. Dr. Rakesh, coming to you, what would be your major takeaway for today's discussion?
Yeah, so I think I will not repeat what Dr. Manish has said. He's put it very nicely. So I'll look at a different perspective. I mean, I'm looking at people who are not knowing that they have diabetes, they are at risk of diabetes. So that very important theme this year, the theme of the World Diabetes Day. We are doing this in the context of World Diabetes Day. So the theme is know your risk, know your response. So we are trying to. I mean, we should try to educate people that what is the risk for diabetes, that everybody above the age of 30 should be screened in our country, should have a test, at least, very simple test, just do a finger stick test with a glucometer. You can easily do it. It doesn't cost a lot of money today, just 10, 15 rupees. You get a strip nowadays, and then you can just check that and know whether you are at you have diabetes or not. And in case you are at risk, you know that what you should do. We have just discussed all that. Have a healthy eating habits. Five, you just ask somebody what are the 6 takeaways. So I'll say 6 takeaways should be eat healthy, exercise regularly, avoid smoking and alcohol, and fourth would be sleep well and follow the advice of your doctor. Maybe those would be the key takeaways that I would like to tell everybody, and know your risk. That's
short and terse and up to the point. Thanks for that, Dr. Rakesh. Coming to Dr. Prem Panda, what would you like to add to the whole, discussion? Anything that you feel we have missed on or would like to say?
Okay. So one more risk factor, I was telling ki there is one more risk factor, that is stress. So whenever a patient is diagnosed with diabetes, he becomes stressed that I have been diagnosed with diabetes, and they just Google out what are the complications of long-term diabetes. So, sir, मेरा ये diabetes कम होगा कि नहीं? Then what to do? And so the thing is that I always tell them that diabetes is not a disease. Diabetes is just a lifestyle problem. If you manage what you are eating, just introspect what you are eating, just introspect your lifestyle, then diabetes is never a disease. So the first and foremost thing is that how you counsel your patient. Okay. So once you do the proper counseling, they feel relaxed and they are able to follow whatever the 6 tips, what our previous speaker was telling. You have to refrain from smoking and alcohol, diet, physical activity. Then the foremost important and most and the foremost, I can say the important thing is that follow up with the physician. What happens in my previous question, I was telling the people who take diabetic medications, they think that my diabetes or the blood sugar has been fallen down, or it has come to the normal range, so they do not come to for the follow up, and after that they come with HHS and coma and so many things. Okay, diabetic coma. So for to prevent all those things, so we should advise them to come on a regular basis. Whenever, if you are not able to come to our clinic, then definitely you can come to your nearby PHC, CSC or district hospital, whatever is there. So one more point I would like to say, that there are certain non-modifiable things that you cannot modify, but there are some modifiable things, so you can modify. So if you can reduce your weight, then definitely there is chances of 16% of diabetes incidence will be reduced. If you do your physical activity regularly, whatever I was telling you, moderate intensity, 150 minutes per week, then definitely the cardiovascular mortality will be reduced by 46%. So there are so many data that if you modify the risk factors, then definitely your life will be just like that of a normal man. So diabetes is not a disease, it is just a lifestyle problem. So you have to follow certain 5 to 6 principles, then you will just have a good life.
Right. Thanks for those insights. Dr. Rajshri, your takeaway in
Well, everybody has said everything, but I am a great advocate of exercise. So it will prevent not only heart disease, but most of the diseases and its complications. So I've come across a very nice thing to tell you, and that is, what would your heart say to you? Your heart would always say that you run for me and I'll run for you. So I would definitely like to propagate exercise as a great preventive measure.
Right, Dr. Rajashri, thanks. So, Dr. Khurshid Iqbal, your takeaway on if you run for your heart will run for you.
Yeah, that's actually most of the tips have been alluded to. I would not like to add anything, but I would like to add just one important thing which probably we have not touched: the heart attack and angina. So any diabetic, if he starts getting exertional dyspnea or exertional chest pain, he should not ignore it. He should report it to his physician right away, because that is the first indication that his coronary artery disease is setting in. Number two, if somebody, particularly a diabetic, gets a central chest pain, there is no other way but just he has to report to the hospital, because this could be a myocardial infarction or an acute coronary syndrome, for which this cannot be treated at home. And earlier he reaches hospital, better it is. Where we call time is muscle, the heart muscle. Earlier, if he is managed within first 1 hour or 1.5 hours, his heart muscle may be totally protected. So, and that is the commonest cause of death in people with diabetes. Previously, some decades back, it was the infections. Now it has been taken over by vascular disease. So early detection of coronary artery disease, early management, and early reporting to a hospital is very crucial.
Dr. Khurshid Iqbal, that indeed was a very, very insightful session, and I must thank all my experts, Dr. Rakesh, Dr. Manish, Dr. Prem Panda, Dr. Rajshri, and of course, Dr. Khurshid Iqbal, for taking out time from their busy schedules and joining us today for this awareness creation. And I hope that in the coming years, we will see, people moving towards a more preventive lifestyle and proactively managing their diabetes and taking care of their heart. And that is all for today. Thank you once again to all the experts for being here with us and sharing their insights with us.
Thank you.
Thank you very much.
We will see all of you again in another episode of this series on the 1st of December, same time. Till then, keep following our social media for more updated information on health. Keep happy, keep yourself safe and stress-free.
Thank you.
That's all for
you.
today. Thank you.